welcome back to Healthy Living. I'm here with Dr. Umair Yousufi and Dr. Erica Kobayashi from the Guam Regional Medical City, who are here to tell us about some ongoing initiatives put on by GRMC to help you keep you healthy this year. So, Dr. Umair, we'll start off with you. Can you tell us a little bit about your medical profession?
Yeah, I'm a pediatrician and also a pediatric cardiologist, so that means I work primarily with children and especially children with congenital heart defects.
All right, and so I just actually saw you earlier this week or last week at the Micronesia Mall during the weekly walk. I understand this is a new initiative ongoing for Heart Month. Can you tell us a little bit about that?
Sure, that was also started by one of the cardiologists here at GRMC, Dr. Holland. She's initiated it last year. It took a little break and we've restarted again. It's basically just a weekly walk at a light or even a little bit of a brisk pace. Anyone's welcome to come. It lasts maybe 20-30 minutes, and it helps get in a little bit of the exercise that the American Heart Recommendation recommends that everybody get.
Yeah, so I was actually there. I saw you guys walking down all the hallways in the mall, and you were going pretty fast, so it was hard for me to keep up. But this is happening once a week? What time does it start?
It's Thursdays at 10 a.m. right when the mall opens. So we're out there waiting for them a couple of us, a dozen of us, waiting for the security team to open the mall, and then we just meet in the center court, and then we just sort of take it from there. Some of the walkers are brisk, but we broke it down into two different groups. There's a group that can walk more briskly, and a group that if you're just starting out, you have some medical condition, they'll walk a little slower. So you won't be left behind. We're not going to leave you in the mall alone.
Okay, and I understand people also do a few stretches to warm up.
Yeah, that's one of the things that American Heart Recommendation recommends as well. A few sort of stretching, muscle, like a heavy muscle kind of lifting. We don't do anything quite so elaborate, but we do a little bit of stretching to just sort of warm people up so they're not starting just from scratch.
Okay, and this is good for all ages, youth, all the way to
elderly? Basically, as long as you're able to sort of walk 2 years and up, probably it's probably fine. As a pediatric cardiologist, I always like to make sure the children involved. It happens on a school day, so if you're a kid, you better have a good explanation why you're at the mall on a Thursday morning. Everyone's welcome to come.
Mm-hmm. I think it's a great way to get the whole family involved. If you have grandparents, parents, maybe young children who aren't in school yet,
yes.
Everyone can get started together, start kind of a habit. So I know this is for Heart Month. Can you tell us, as a heart specialist yourself, why is exercising, even just brief, or brisk walking through the mall, how is that beneficial to your heart health?
Yeah, so one of the risk factors for cardiovascular disease, and that includes things like heart attacks and strokes, is a sedentary lifestyle, so meaning just sitting around. So anything that you can do to get out of that mode of being in a sedentary lifestyle is something that's going to decrease your risk of a heart attack. Here in Guam specifically, speaking with my adult cardiology friends, they tell me a lot of people have heart attacks and strokes at a much younger age than back in the mainland. So especially important for the people here in Guam to participate. We recommend, in terms of the Heart Association, that 30 minutes a day for 5 days a week. That works out to be about 2.5 hours. Is the ideal recommendation. So coming to the Heart Walk once a week in the mall gets one of those 5 days off your list.
Definitely. All right. Well, thank you so much for that. We'll see you hopefully every Thursday at Micronesia Mall. And also, Dr. Erica, I understand you're also a pediatrician. Yeah. So can you tell us a little bit about your experience and what your specialty is?
Sure. So I'm a pediatrician at GRMC as well. I've been here since about July, and right now we really are mostly doing inpatient work, so children that have to be admitted to the hospital, either to the regular floor or to the intensive care unit, and then also newborn babies. That's kind of where I focus.
Okay, so I understand that you're going to be participating in this joint conference coming up in March. Can you tell us a little bit about that?
Sure. So along with GMH, GRMC is putting on a joint conference called Advances in Pediatric Care that Dr. Yousufi and myself will both be speaking at. We have 7 different speakers that are all pediatricians or pediatric subspecialists that will be speaking at the conference on March 5th at the Outrigger. It's primarily designed for other health professionals, so family practice doctors, other pediatricians on the island, nurse practitioners, ER, urgent care, people that take care of children. And the goal of it is really to kind of bring some of the newest research and the latest guidelines to the island of Guam. It's hard once you finish your training and are in practice. Sometimes it's hard to keep up with really everything that's going on in research, because there are more than 100 journals focused on pediatrics. You can't read all of them, and so together with GMH, we're trying to put a joint effort in to help update everybody on new guidelines and new advances in research related to pediatrics.
I know it's definitely important, because just I can see throughout the years, one year there's one recommendation, and the next year it changes, it gets updated. So why would you say this is so important? And if people want to find out more, how can they find out more information?
Sure, I think it's important. Like you said, there's always something new coming out, and there's always new research that's pointing us in one direction or the other, and it's important for us as professionals to try and keep up with the latest advances so that we can provide the most up-to-date care to our patients. In terms of finding out more information, the marketing department at GRMC would be happy to provide additional details on that, and we really welcome any health professional that would like to register for the conference. There's no registration fee, and like I said, it's Saturday afternoon, March 5th from 2 p.m. to 6 p.m.
All right, well, thank you so much for joining us today. Some definitely helpful information that we'll be looking forward to learn more in the future. All right, well, stay tuned. Coming up next, we'll give you tips on training for the upcoming Guam International Marathon with Claire Calvo. We're back after this.